Thank you for joining us. Fibroids affect many women at all ages, and there are often questions that women have because they may not consider asking it when they're with a healthcare provider, because actually the symptoms can cover all aspects of their life, including exercise, work, social activities, relationships, general well-being. And so I'm delighted to say that we have the lovely Dr. Shilpa McQuillan, who's part of the British Menopause Society Accredited Menopause Specialist, and she's a community gynecologist and founder of Berkshire Menopause Practice, and a general practitioner as well. And I'm really delighted that we have you with us today. Hi, Shilpa.
Hi.
Hi.
Thank you for inviting me.
Oh, Mark, thank you for your time. The community at Adore Your Pelvic Floor really appreciate your time, because I know it's so precious. But we do get questions, and me as a female working in pelvic floor health, I have questions. So I think it's really important to just get a really good understanding of what are fibroids and their symptoms. So let's maybe begin with what are fibroids. That would be a
Yeah.
good idea, yeah?
Yeah, absolutely. It can be really confusing. I've brought my trusty friend with me. So, fibroids are benign tissues found within the womb. So, this is our womb here, and they can occur in any layer of the womb. So, if we give an example, I'm just going to give you a bit of an anatomy quick overview. So, this is our womb lining in here. These are the layers of the womb. This is the cervix. So, you can get fibroids in any parts of those areas. And for patients, when they get, for example, ultrasound reports, it can be quite difficult to navigate. Well, what does that mean? So I'm just going to give you a quick buzz of what the types of fibroids are. It's not an anatomy lesson, don't feel you have to know. But if you do get told those information, it's just to give you that little bit more. So you can get what we call submucosal. So this is within the lining of the womb. You can get something called intramural, that's within the layers of the womb. You can get something called subserosal. So
Okay, Shilpa has just disappeared for a minute, so keep hanging on here.
oh, there you are.
Hi. Where did you get up to? Do you think we...
Fibroids.
Okay,
Different types of fibroids.
lovely. I'm sorry, Shilpa. I just don't know what happened there, but thank you very much indeed. So, with regards to symptoms, what should we be looking out for?
The important thing to understand is everyone is individual and about individualized care, because symptoms really do vary. First of all, some people don't get any symptoms and they know that they've got fibroids from a coincidental finding of a scan they may have had from something else. Some people get very periods, and the kind of symptoms that they would experience is things like anemia, or just things like flooding, clots with their periods, just uncontrollable periods. Other symptoms some people might get might be because of depending on where it is in here. Got a massive fibroid sitting in your pelvis, this can press on other structures like your bowels, like your bladder, like your spine. So some people may then get back pain, they may get constipation, trouble urinating. So these really, really vary in kind of what happens. The other thing is fertility. So some patients may have trouble conceiving, and actually it could be because there's a fibroid sitting in the womb stopping the embryo from implanting. Some people have problems when they're delivering their baby because there might be a a fibroid sitting in the cervix that needs to be looked at. So as you can see from all of these different things, the symptoms vary so much. That's why it's so important for individualized care with this.
So how often does a fibroid occur for younger women? Because that's really interesting to find out, because we understand quite often we understand it as, from maybe 45 years plus, there's a higher number maybe, but how often with the younger population?
Yeah, really, really good question. So of women, it tends to happen. Can you believe that's so common, isn't it? So if you 100 women, you'd end up finding 50 of them would have fibroids. So that's why I'm saying about it can be a coincidental finding, and not to get frightened, because symptom and treatment is about individualized care. Now, they tend to happen in older women, as in less than younger women, but they then tend to shrink around postmenopause. So yes, you're more likely to find out you've got fibroids in your 30s and 40s, but then they tend to shrink in your 50s. Now, there might be some people listening going, well, no, I'm postmenopausal and I've got fibroids on my scans, but those fibroids may have been bigger before, or there's certain factors that can increase those fibroids again that want to try and shrink, and that is things like hormone replacement and contraception, because hormones like estrogen and progesterone can increase fibroids as well.
Okay. So I guess then it's complicated and multifactorial here with regards to symptoms. But can fibroids mask other issues? Say you have a fibroid and you've got your typical symptoms. Yeah, how often could that mask other issues?
And it's very difficult to say, isn't it? I think the important thing is, if you've got any symptoms that are not right for you, you must get investigated, because it's a really difficult question to answer. Because if you've got symptoms that are very indicative of heavy periods, then there are certain other conditions that present similarly, like endometriosis. Some people, unfortunately, just have heavy periods, but it doesn't mean you should just live with it. So my answer to that really would be, keep a diary. If anything is abnormal for you, only you know what is normal for you. That's what I say to all my patients, that if you notice something different to your normal, then that's not normal. And then we need to look into that. That doesn't need full-blown investigation, but it might just need that observation or keeping a diary. But the important thing is, if something changes, make a note, and then if it gets investigated, even if it's masking, let's say something like endometriosis, you're going to find out. Endometriosis tends to be a go on symptom diagnosis, but if you can find out what the reason behind your heavy bleeding is, of course, it won't be masking. So seek that help early is what I would say to that.
Okay, so how do you gain a diagnosis?
Ways you can diagnose. First of all, examination. So as I said to you, fibroids vary, don't they? You can get the tiniest fibroid, but some people literally have the size of a melon that is completely impacting their tummy, and they will present to the GP saying, I feel like, am I pregnant? What is this? So the first is the examination. So your GP may examine you, there's a hard mass there. The next step potentially would be something like an ultrasound. So ultrasounds can pick up fibroids, but actually they can, you can imagine this massive mass can be quite vague in your pelvis. So with something like that, there's lots of different other ways. You may need an MRI scan, because that's more sensitive and that can look at a larger area than, for example, a vaginal probe looking for ultrasound. There are things like hysteroscopy, so that's doing a camera test looking into the womb. So as I said to you, the fibroids are in different areas, so depending on where they are is what different modalities are going to pick up. A hysteroscopy is only going to pick up something that's in the inner lining of the womb, because that's where a hysteroscope goes. An ultrasound can pick up fibroids everywhere. An MRI scan that scans like this can pick up fibroids anywhere. Then there are other things like a laparoscopy, so through the tummy, and of course they will pick up not the inside the womb, but on the outside of the womb. So lots of different ways of picking up, but I always believe in start basic. Examination. If your examination is suspicious, or even if you don't find one because it's tiny, but someone presents with really heavy periods, pressure symptoms, then the next step would be something like an ultrasound.
Okay, so in your experience with the women that you meet and work with, how often do you think women leave it before they actually come and seek advice and living with symptoms?
That's so important. And I think we're so much more aware of women's health now, aren't we? We're trying to be real advocates of promoting that, don't just leave it. I believe many women, there's so many reasons. They think it's normal. They've not had the education to know what might be going on. They can't get a GP appointment. They think that actually having heavy periods, they're going to be dismissed. So there's lots of different reasons. And I have I truly believe, as somebody who goes out and does lots of educational talks in the community, to corporate, to my colleagues, I really do believe that education is still slightly missing for women to actually speak up. But what I would say is, be your own advocate. Keep that diary. If anything's different, go to your doctor or go to a specialist, somebody who has that understanding and has the time to go through with you what could be going on.
Yeah, education in schools in their PSHE would be a good thing, as with many other things in women's health.
My local area, I actually go into schools and teach them about women's health, teach them about menopause, can you believe, even at that age, because I think it's so important. Then it just doesn't become a bit of a shock when you get to there. So teaching them about periods, all these things, it's absolutely important.
Otherwise, we're left to like work it out as we go along through the years. And yeah, forewarned, and knowledge and education is everything. So, what is the conservative treatment that women may experience?
As I said, individualized care. You may not even need treatment. You had a coincidental finding on a scan, you're not getting any symptoms. That does not necessarily need any treatment. And one thing I always encourage women, so having been a gynecologist myself, and I'm a GP, and now I'm a community gynecologist, I've had the very privilege of doing all of that. So I have an all-rounded approach to how I approach it. And I'm very, very open with women that absolutely, if you feel that we need investigating, let's do it. But let's do it for the right reason, because let's not forget, having a laparoscopy itself can cause adhesions. It can cause scar tissue, which worsens your pelvic pain. It can worsen your symptoms. So let's do things for the right reason. So if you've had a coincidental finding pickup, that doesn't necessarily need treatment. It's not worrying. They're benign. Fibroids are benign. So your treatment really, including conservative treatment, depends on your individual symptoms. Someone's getting bleeding, might be heavier than normal, but it's about quality of life. Some people can deal very well with heavy bleeding. They wear thick tampons, they're good to go. Some people, it affects their job. If you're a swimming teacher and you're having to change your tampons constantly and wear thick pads with that, that's not practical, is it? If you're getting pressure symptoms and it's really affecting your back, you're getting backache, you're constantly unable to wee, how can you function like that? So your management really does it depend on quality of life and where your fibroids are and how big they are.
Yeah, because when you're living with fibroids, I guess you're thinking about what you're wearing. You're more conservative about colours. I know that in one of the workplaces I was given a talk to, they were saying, and I was really pleased, that they purposely made the chairs a darker colour so that when women are standing up, they're not, because they tend to look behind them straight away, so that there's less embarrassment on that front as well. So, yeah.
Amazing. And I talk about this a lot. I talk about how, sports, whether you're amateur, whether you're a professional, why sports shorts still white, for women. Simple things like that people might not even think about, but can have a huge impact on someone's mental health. So let's not forget, when we're talking about treatment, we are looking at an all-rounded approach here. This is about someone's quality of life. It's about their physical well-being, but also the impact it has on your mental health as well.
Yeah, because there's got to be quite a lot of anxiety involved when you have real heavy bleeding, when you are at work, having to keep nipping out to the toilets, and people being aware that you're nipping out to the toilet more regularly and feeling like how do you explain yourself? Not that you should have to, but then you feel you need to explain yourself. And it can really get complicated, which creates more anxiety, doesn't it?
And that's why it's so important that workplaces are real advocates and real forefronters for improving women's healthcare, because are they using communal toilets still? Have you got adequate, I don't call it sanitary, I just call it women's healthcare products, because it's sanitary makes us sound unhygienic for having periods, doesn't it? So do they have women health products in their toilets? Like you say, are there adjustments made for women? Do they have a good kind of women's health champion who they can talk to? Because just having a tick box, with a dusty shelf full of protocols isn't really going to going to do it. That just shows you've ticked the box, but have you really thought about it? So yeah, that's why it's really important. And I do a lot of work with corporate or workplaces to try and improve that. And I think a lot of people are on board of wanting to make that, they're just not necessarily aware of how to do it.
Yeah, and like you say, you're champions in the workplace and educating the men and the managers as well, isn't it? So that if you have a male
Absolutely.
manager, it doesn't
It
become
is
problematic.
not it's absolutely not just about women coming. I always encourage men to come to my consultations with their wife. I encourage people to come, whether they're employers, whether they're fathers, whether they're partners. You will know a woman in your life who's important to you. So it's important you know about this. And children as well. Like I say, I go into schools and teach children, both boys and girls, because and my son, I teach my son, I bring this, I bring this out. I've got a vulva model as well, teach him all about anatomy, because I don't want it to be a taboo where he makes fun of girls when they're older, when they have period problems, and that, let's try and break that taboo.
Exactly the point. I was very proud to hear that one of my boys at school, a girl had been bleeding and he was walking behind her and he just gave her his cardigan to put around her. And I was
Amazing.
just
That
thank
is
you.
very, yeah, absolutely. That's how it should be. That's
Yeah.
wonderful. Yeah.
And I think to just finish this off is that we will all know women with fibroids, and there won't be a badge on their top saying I have fibroids, but we will know people that have got fibroids and experiencing significant symptoms maybe, and so actually just be mindful and more aware of even our professionals that are working with us, if they are finding it more difficult that day, it could be down to their own symptoms. And I think it's just good to be mindful of that, to be honest.
And, coming from what you do, Pepper, it's really important to forget it's not just about medical. Keep in mind those patients that have got fibroids impacting on pressure, lifting heavy weights, what that impact can do on your body. You know, bleeding and going to the gym and running when you're anemic, what that can do on your body. It's not just about me as a doctor. I also advocate, that kind of healthcare approach as well. And let's not forget the acute symptoms. If you've got a very big fibroid, that can twist, and that can be an emergency. So it's really important to be aware of your own body and what's happening, and seek help early if you're concerned, just so that you can talk it through with somebody.
Oh, well, thank you, Shilpa. I'll put your details in the I'm going to upload this to YouTube and to a few other platforms, and I'll have your contact details in the listing, and your Instagram, because I know that your Instagram will have lots of information as well regarding all things gynecological and women's health. So much appreciated. Thank you for your time. Nice to
Pleasure.
meet
Thank you for
you.
inviting me.
Oh, well, thank you, Shilpa. Much appreciated.